Hi everyone, thank you so much for joining us today. Welcome to our podcast, Know Your Medical Maestros, and we're so excited to have you here. So this will be our first episode, and we are delighted to have our first guest. He is the youngest oncologist in town, and I will allow him to introduce himself. Karibu sana.
Thank you so much for having me. So my name is Dr. Andrew Odhiambo. I am a medical oncologist. I practice here at the Nairobi Hospital. I'm also a lecturer at the University of Nairobi, and I'm pleased to be here for your first episode of, what did you call it? Knowing Your
Medical Maestros.
Thank you for having me.
Thank you so much. So I'd like to get a brief just overview of what do you mean as oncologist. So who is an oncologist?
An oncologist is basically a doctor who takes care of people with cancer, and there are different types of oncologists depending on what area you have specialized in. Mm-hmm. So for example, you have oncologists who treat patients using radiotherapy. Mm-hmm. So they are called radiation oncologists. Mm-hmm. Then you have oncologists who treat patients using, we call it systemic therapy, and the most common one out there that people know is chemotherapy, but there are many other medicines either injected through the vein or in tablet form. So they're just basically treatments that travel throughout the body. Those are called medical oncologists. Then you have another group of oncologists which is now really picking up in the country. They are called hemato-oncologists. So hemato means blood. So they treat patients with blood cancers like leukemia and lymphoma. And then obviously you have pediatric oncologists for the children and adolescents. You have surgical oncologists. They are surgeons now who are only trained to operate on patients with cancer. And then there's something called gynecologic oncologist. So these are now a subset of the regular gynae that you know, but now he or she has gone deeper into studying how to treat gynecological cancer. So it's a whole basket of many different types of people, but generally we are the doctors we are the main doctors who take care of cancer patients. Cancer patients are not only taken care of by one doctor. You'll most of the time have a team of 3 or 4 doctors because we move as a team. But the oncologist is the overall person responsible for that patient.
Great, thank you. So I think the other thing would be, how did you end up in this profession? Is it something you always knew you wanted to do as a child, or it just came in your adulthood and in your, tell us a bit more of that.
So it's a bit of an interesting journey with its twists and turns. As a kid, I had no idea I was going to do medicine or to become a doctor. After having gone through high school and, dropping your subjects and deciding what you want to do, I was pretty much open-minded. I liked biology, yes. I liked chemistry, yes. Very poor in physics, so that was out. Mathematics was just there. So I finished high school. I didn't get a plain A, as to what most people would imagine. All doctors are plain A students. I had an A minus, and at that time I didn't have enough points to come to medical school, so I was called for some economics course in main campus. So I was like, mami, nitafanya hii economics kweli? I was like, hapana. I didn't even, maybe in retrospect I could have done economics because now economists are wealthy people.
Making the money.
So I've always been that person who, my parents never pushed me to perform. Like, you need to be number one. Where's your report card? Where is this? I was never pushed. So I had to push myself. So I said to myself, what course is the most challenging course that I can do? So after ticking out, remove architecture, remove actuarial, remove law, remove this, I was left with medicine. So I went to Chiromo. I saw 3 lines, one for medicine, one for dentistry, one for pharmacy. So the longest line was the one for medicine. So I said, this one is the one that makes sense for me. So I queued, I got a registration number, and that was it.
Amazing. It's interesting. Most people would assume that was the path for you from the beginning. All right. And then now you're into medicine. There's so many specialities under medicine. Why oncology?
So that also has an interesting twist. When I finished my undergraduate studies, that was in 2007. And FYI, I'm not the youngest oncologist. There are many younger ones now after me. Okay. But I still consider myself to be young at heart. Yeah. But in our community, I'm actually now going to be middle to almost senior, because when I came into this job almost 15 years ago, there were very few oncologists, and that's the amount of time I've been doing cancer work, including my training time. But back to why oncology. So after finishing medical school, I wanted to be a plastic surgeon because I used to watch those plastic surgery things on E, and there was a lot of lifestyle things, and plastic surgeons looked cool. They drove nice cars, so I wanted good things for myself. So I wanted to do plastic surgery. Obviously, stories can change. I went for internship, and one of the physicians there, who is still one of my good mentors, is the one who made me see another side of internal medicine. So he then told me, hey, you need to go back and do internal medicine. It's something you'd be good at. So I came, did that. And then while I was doing my internal medicine, I still wasn't sure that I wanted to get into cancer work until one of my other very good mentors kind of saw a hidden talent in me and said, Andrew, you really understand this oncology, genetics things, and how cells divide and become haywire in the body and how they stop growing, and which is just the underground science of oncology. Was very easy for me to understand. So it took an experienced oncologist to see me in a different reflection and saw a talent that I didn't know I had. So she then offered me a chance to sit with her in clinic and see patients together and just learn, get your hands dirty, start learning from the ground up. And ever since then, that was in 2010, ever since then, I've never looked back. Every time I do it more, I enjoy it more, I love it more, and it brings me so much joy when you bring, when you remove suffering from your cancer patients, because these patients go through a lot of, it's not just the physical torture of the disease, the emotional torture, the financial distraction that cancer brings, but just knowing how to navigate, guide that, because the whole family is usually sick, not just the patient. When a patient gets cancer, you are treating their family, so you have to know how to manage that family from beginning to end. Whether the end is a mortality or a cure, both endings can be good, because there are some patients who you know things are not good.
Yeah,
You know,
right from the
and
outset.
naitanga soft landing. So if you can take a patient and a family from a period of distress to a period of them coming to terms and understanding that, you know, Jimmy has 3 weeks left, so what do we do? And then you take them through slowly, minimize and eliminate suffering, maintain human dignity. The day he will go, the family will thank you that somebody has gone and has gone well. So both of those situations bring me joy. Obviously, it's a specialty that also has a very dark side, which maybe can be for another episode. But yeah, ever since that time, I've never looked back. If you take me back, I will choose oncology again and again and again and partly because it's just a very captivating field. If you don't like boredom,
That's the field for you.
if you do not like, if you like challenges, and it goes back to I want a challenge. It's a very, I don't use the word difficult because even cardiologists will say our work is hard. Even neurologists will say our work is hard. But boy, managing cancer is difficult. You have to be on your toes. You have to consult with other specialties. You have to work as a team. Dynamics, second opinions. You're battling with opinions from overseas, and it's the dynamics. So it's actually exciting to come to work. Because you don't know what the day is. Yeah, I really pity my friends who treat like hypertension and diabetes because it's the same thing. Monday to Friday. For me, even next week, I don't know. There's some cases you'll see and you're like, guy, I've never seen something like this in my whole life. You call somebody else, you say, are you for real? I tell you what, I've never heard of that. I just see it in books. So yeah, it's something that it's challenging but also very passionate.